This headline caught my eye. Low fasting plasma glucose level as a predictor of new onset diabetes in a large cohort. It's from a Japanese general population. So you begin to think, well, is this one of those esoteric red herring type things? And then I looked at the title of the journal. It's Nature Magazine. It's scientific reports out of Nature Magazine. Recent, 2018. So what's going on here? Actually, 17th of September in 2018. So let's take a look. Low fasting plasma glucose as a predictor of new onset diabetes in a large cohort from a Japanese general population. September 17th, 2018. Now this is from the abstract. Sorry, again, I'm still working on my visuals here to help people follow along. As always, I will give you a reference to the article, a link to the article under the video. Now, I'm not going to read this whole thing. I'm just going to make a few comments about it. There were 186,749 participants without diabetes. This was from data obtained from a large national study back in 2008. 171,000 of those had no history of cardiovascular disease, while 15,341 did. Participants were classified into 8 categories according to their fasting plasma glucose levels, and they did unadjusted and multivariate adjustment log regression models on these things to look at risk for upcoming diabetes. And they did find increased risk, of course, as you saw 90 and above, but also you saw increase below 70. And we'll show you that in just a few minutes. Now, what study group was this, or what large system national database was this? It's called the Specific Health Check and Guidance System, SHCG, in Japan. It was launched by the Ministry of Health, Labor, and Welfare in Japan in 2008. The target was the Japanese general population between ages 40 and 71, estimated to be over 51 million, actually 51,919,920. The current study was performed as a part of the ongoing design of the comprehensive health care system for chronic kidney disease. So interesting way to study, way to take a good national database and figure out some interesting stuff. We'll get into those U-curves, or more specifically J-curves, in just a minute, but first a brief introduction. My name is Ford Brewer, F-O-R-D, Brewer, B-R-E-W-E-R. Started off as an ER doc. In the ER, most of what people bring in should have happened decades later or been prevented entirely. All that death, disease, and disability. So I got really focused on that. Went to Johns Hopkins to learn prevention. They have a great program there, and it includes clinical prevention, which most programs didn't include at that time, over 30 years ago. I had a blast, enjoyed it, did great, ended up running the program, and have ended up focusing on prevention ever since, both with patients and primary care staffs. I've been a corporate medical director inveterately, just over and over and over again, helping primary care doctors understand how to prevent disease rather than waiting until that disease has already happened. Now, I promised some U-curves or J-curves a few minutes ago, and this is them. This is out of the study. So as you see, for sure, once you hit a fasting blood glucose level of 90, darn it, or above, let me go back. I'm still getting used to these new techniques for showing you the visuals. As you see, at 90 and above, you just start getting increased risk, significantly increased risk, and above 110, major increased risk for diabetes. And some of these folks already had cardiovascular disease. They looked at both models. The red group is folks that already had cardiovascular disease. The blue in this graph is the folks that hadn't had recorded cardiovascular disease yet. Those of you that have seen more videos in this channel know, just like I know, a huge portion of those people that are in the blue group already had cardiovascular disease. They had inflammation, they had plaque in their arteries. It had just not been seen yet. And if they did the right stuff, like looking at CIMT and things like that, they would have seen that these people do have cardiovascular disease as well. Now, they did some things and said, okay, let's adjust this for, I'm not going to get into the details of what they adjusted it for. The bottom line is, as you can see on the right, the chart on the, or the graph on the right, you still got that risk. We all know about that risk on the right-hand side of these graphs. What is a surprise is the risk on the left-hand side. Below 80, down below 70 especially, it really started to increase. Now, there was a clue, and here is the clue. Characteristics of the group with fasting plasma glucose levels less than 70 was previously reported in a total of 1,197,384 Korean general populations. Ones with fasting glucose less than 70 showed a high percentage of current smoking and low physical activity, which were observed in our participants in the same category. So they went on to talk about, well, maybe this is fasting blood glucose less than 70 associated with smoking and inactivity. And they're saying, they tried to get into some potential mechanisms on how smoking and inactivity could be associated with both a low blood glucose followed by a significant increase in diabetes. So that part, I don't think they don't know yet. I mean, it's very clear that they don't. And again, this is just a first new signal of some things to worry about. Those of you who are doing all of your right lifestyle things, you're watching your diet, you're watching your activities, you're doing your high-intensity intervals, and you're not smoking, I don't think we have to worry about a blood glucose less than 70. And I think overall, that's the punchline. Thank you for your interest.